Good evening, everybody, and welcome to Sparks Africa, celebrating African excellence to inspire the next generation of achievers. Today, I'm delighted to welcome a group of dentists, black dentists, here in the United Kingdom. They are all part of an organization called African and Caribbean Dental Association. You're all welcome. Welcome.
Good evening.
Good evening.
Hello. Hi, good evening.
Great. Thank you very much for joining us today.
Off with the introductions, just so that we get to know who you are, and then we'll plunge straight into the conversation. So if I can first call on Timi to introduce himself.
Yeah, thank you very much, Nero. My name is Timi Adesanya. I'm a practicing dentist in Kent, Gillingham, and I also chair the African and Caribbean Dental Association, which is a group of dentists of African and Caribbean ethnic origin. And we have a platform where we share ideas, motivate ourselves, and learn from our experience, and we give back to the community. Thank you.
Thank you very much. If I can ask Sophia just to introduce yourself.
Right, so I'm Sophia. Thanks for having me, as I said. So I am a dentist. I work in community dentistry, and I am also a clinical fellow for Oral-B at the moment. In terms of my background, I am from a small island called Montserrat in the Caribbean.
Thank you very much. If we can go to Yewande.
Hi everybody, my name's Yewande. I've recently qualified as a dentist, only a couple of months ago actually. So I'll be starting my foundation training in September. I'm also a YouTuber. I have a YouTube channel where I encourage students who want to go into dentistry as well. And in terms of my heritage, I'm Nigerian. I was born in Nigeria and I came here when I was around 3 years old.
Thank you very much. So if we can go to Kavin, last but not least.
Hello, good evening, everyone. My name's Kavin Andi. I qualified in dentistry in 1999, in medicine in 2004. So I'm a practicing oral and maxillo-facial surgeon specializing in head and neck cancer and reconstruction in particular. I work in one of the cancer centers in London, and I'm also the trustee of the African and Caribbean Dental Association.
Great, thank you all very much, and very, very warm welcome to you. As I said in the introduction, Sparks Africa is about celebrating African excellence to inspire the next generation of achievers. And I think you are all, alongside your organization, Sparks of Africa here in the United Kingdom. And we're really, really pleased that you're able to join us today. Particularly Yewande, being a young person, I think you will be a great inspiration to a lot of the young people who are watching today. And a lot of people who might not see being a dentist as a potential profession for them. So I'm very happy that you're all able to join. Andi as well, a great welcome to you. I've listened to you speak on many occasions, and if I'm not the age that I am, I'll probably have been inspired to become a dentist myself, listening to your story. So it's all fantastic to have you all here. I think where we should start is really to talk about the organization, the African Caribbean Dental Association. Why this organization? Why was this organization established? So if I can go to Timi, just to enlighten us a bit more as to why you've set up this organization.
Yeah, thank you, Nero, for that. Yeah, so the African and Caribbean Dental Association was formed in 2012 because we saw a need to address the oral health inequalities, especially with regards to ethnic minority, and also to create a platform for dental professionals of ethnic minority to network, share experience, and learn from themselves and give back to the community, because we at that time felt there was a vacuum and there was nothing to collaborate the efforts of African and Caribbean dental care professionals. So hence the reason why we decided to form the association. Outside that, we were very keen on inspiring the next generation, because we feel that that's where the change is going to come from. And we do that by mentoring and providing scholarships for young professionals and young adults who might want to pursue the profession of dentistry or dental care professionals.
Great. Thank you very much for that information. So one of the interesting things when we put the information out that we'll be holding these conversations, a lot of people commenting that they didn't even know that there were Black dentists. So when people walk around, they certainly don't see many Black dentists. And certainly when you look at the statistics in terms of dental school across the country, the representation is significantly low. If I can go to Yewande, being a young person coming into a profession like this, I imagine that when you were in school, you didn't see Black dentists coming in to talk to you. So where did the inspiration come from? Where did you begin to think dentistry is what I want to do?
Yeah, you're completely right when you say that you don't really see a lot of Black dentists, because that was the case for me. I didn't know any Black dentists when I first applied, didn't have anyone in my family in the medical field or anything like that. So it was kind of strange for me to go towards dentistry. I sort of just found it by accident, because I just looked at my skills, what I enjoyed. I knew I wanted to be in the medical profession, not really medicine per se, but I looked at other things and I came across dentistry. And then once I discovered that dentistry was something I wanted to do, I just put all my effort into trying to find people that could help me. I think as a young Black female, it is hard to find people that will help you in the dental field. I didn't know the Afro-Caribbean Dental Association existed 6 years ago when I was trying to apply. But if I had known then, I think things would have been so much easier for me, because it's such a great association and there are so many dentists in there that are willing to help. So if there are any students here listening, do get in touch with the Afro-Caribbean Dental Association, because I do feel that a lot of dentists will help. But I did find it particularly difficult to find work experience. Eventually I did get some work experience. And then from there, I just saw how the dentist worked. And yeah, I just sort of loved it. And I knew that was what I wanted to do.
Fantastic. Thank you very much. That's great to hear. Sophia, if I can come to you, because this is the African and Caribbean Dental Association. And from my perspective as Sparks Africa, one of the things we set out as a mission is to find a way to engage all the people of African descent, regardless of where they're born or where they live today. So that's very important to us. In terms of the makeup of the organization currently, is there that combination of people of African descent, people from the Caribbean community coming together to work within that organization to work as a single voice? Sophia.
Yeah, Timi will be probably best placed to give you the breakdown, but the group is a combination of African and Caribbean, and it's very blended and a very open group, and we all get to exchange ideas, and yeah, so it is very collaborative.
Great. Thank you very much for that. I want to come to Kavin. As I said in my earlier introduction, I think I find what you do extremely exciting and extremely interesting. And I think a lot of young people, particularly young men, when they hear your story, will be very excited by that story. Can you just tell us a little bit about this specialism, what you do, and how you came to that specialism based on your experience as a young person and the sort of things that you were playing with and so on and so forth?
Like Yewande and many others, I didn't know many dentists in the workplace. My dad was an orthodontist, but I wasn't really interested in the speciality in that way. And when I was 12 or 13 years old, I ran into a lamppost on Baker Street and managed to smash all my front teeth and my top jaw. I ended up at Guy's Hospital. To cut a long story short, I had 4 years of treatment going up and down on the tube. And it was during that time I sort of began to see patients, and I'd see them regularly. And these were patients who were coming back for oncology follow-ups. There were some children who were having treatment for the face, mouth, and jaws. So that sort of sparked my interest. But the key thing was, because I didn't have any front teeth at the time, I really didn't smile freely for a good 4 years. If you look at all my school photos at that time, it's very much with the lips closed, not wanting to show I had a little partial denture at the time with a gold clasp. It's the thing that hooks around the teeth. So that would shine away at the flash if you did take a picture. So I was very aware of that. And when I got my tooth back, it gave my smile back. And I felt, this is the feeling of doing something like that for somebody else was what sort of drove me into, actually, let's give it a go. Let's find out a little bit more about what dentistry is all about. So my interests were mainly in art and sculpture. I was more of a creative type. And that's what I wanted to go into before the accident. And eventually, when I did get into dentistry and dental school, and we started doing anatomy, I realized it's all the same thing. It's all art and sculpture in its essence. So the message I'd say to everyone out there really is that your lack of awareness of what the subject matter is probably denying you of an opportunity to build a career in something that you're very good at. And dentistry has lots of spheres. There are many subspecialities that are suitable for different skill sets. So if you want to become a surgeon and manage soft tissue anatomy, and you like putting things together, then that fits in very nicely. If you're very technically minded and you like precision, then there's a lot to do in restorative dentistry. That's creating crowns and bridges. There's prosthetic dentistry, which is another subsphere. So there's something in it for everyone, and you make of it what you want based on your own interests.
Great, thank you very much for that. I'm sure there's a lot more to say because it clearly is one of those professions where there are so many different branches that people can go into. And I think that's one of the things that excites me about this organization, the potential that you have within a community that there might be a lack of information about this profession, to be able to reach out into communities to share exactly what you do. So Timi, do you want to just talk to us about some of the programs, the active programs, both on the side of trying to raise awareness in terms of engaging students, school children, and so on and so forth. Also on the side of oral health, the importance of oral health and what you're doing in particular to reach into BME communities with information in that area. And then perhaps a little bit about the support that you give to students who are already within the dental school, that sort of support that you provide.
Yeah, thank you, Nero. Like I said earlier on, one of the main reasons why we established the association was to help people of ethnic minority to access dental care and have, to have better oral health care. So that was one of the reasons why we formed the association. And how we do that is we have oral health promotion programs on some particular days where we go into the community, we enlighten them about the oral health, how to care for that, and to access oral health care. So that's one of the programs we do. And we have 3-4 programs in a year to provide awareness about oral health, one of which is Care for the Cold, which we do in the December period. And secondly, we also go into schools to see young adults of the age of 15 to 17, where we enlighten them about the career of dentistry and how they can also follow any professional career they want to do. So it's just giving them their enlightenment and mentoring them to know that they can achieve what they want to achieve. And for students within the association, we provide sponsorships, we provide mentoring programs, and we also help them to make career decisions as they go forward.
Great. Thank you very much. Thank you very much for that. So just for our viewers, if you want to comment, please feel free to comment. If you have a question for any of our dentists, please type in your question in the comment box, and we will be able to put your questions directly to our guest this evening. So just in terms of anybody who wants to comment, please feel free to comment or ask a question. Now, we're going to move on to another side of this, which is pretty much about the whole dental profession and this issue about underrepresentation at all different levels of the profession. The last broadcast, we had a conversation with a group of young doctors, and we talked about their presence within the NHS, how they represent across the hierarchy of the NHS. And I think the dental profession, there are similar challenges in terms of representation. So maybe, Sophia, if we can just explore with you that underrepresentation of people of African descent within the dental profession in the UK, and in particular within the hierarchy in terms of I think it's called the General Dental Council, or the other structures where dentists are represented, just to perhaps explore with us what the representation looks like and what can be done to address it. So, Sophia, if you can help with that, that would be great.
Yes, so within dentistry, it probably reflects very much how the NHS and healthcare is that the Black and BME are very much underrepresented at all levels. So if you start from the sort of education level, so that undergraduate entry to dental schools, I think Black applicants make up at about 1%, or at least are accepted. And as you move through, at these academic and clinical, sort of senior clinical positions, there is definitely a huge underrepresentation from Black professionals, and even more so when you get to leadership. So if you think about these organizations that give leadership towards dentistry and provide strategies and policies and direction, their boards are not diverse at all. And we've got a diverse workforce within dentistry, but we don't have diverse leadership. So it is really important that we start to address this, looking at diversity and inclusion. It's been really inspirational actually seeing that a lot of students have been being very proactive in talking to their dental schools about how they can look at inclusion, so entry levels for pupils, and also about the curriculum, so how they can diversify their curriculum, making sure that they're being taught how to treat a diverse population. And that's really important. For myself, we're currently putting together a strategic oversight group for dentistry, which is going to look at inclusion and start providing some direction for organizations about how we can be really proactive and efficient in driving inclusion throughout the whole profession.
Thank you very much. I think that's a very important point that you make, because it's important that these organizations are representative, one, of the population that they serve, and making sure that through, whether it's through dental school, right through to the regulatory bodies and so on, that they are representative of the community. And I think this issue has really come to the fore very recently. So it's good to see that you're putting up structures to be able to address these issues. And I think, Timi, from your perspective, in terms of the association, this might be one of the key areas that you begin to explore. You have people like Kavin on your board. You have up-and-coming young people like Yewande. These are people who clearly can rise through the ranks in terms of representation on some of those bodies that we've talked about. And if you recall, last year, whilst I was in government, I hosted the African Caribbean Dental Association in government, again, to have these sort of conversations about how you can influence policy at a national level, influence the NHS, and engage in conversations that can enable us to build on your achievements and to make sure that people from the African Caribbean background are able to make a contribution to the NHS and to policy on health more broadly. So as an organization, will you be doing any programs to support individuals who want to go onto boards or who want to sit on particular regulatory bodies within the dental structures?
Yeah, thank you, Nero. So at this present time, the association is in dialogue with the Faculty of General Dental Practice, which is the academic home for general dental practitioners. And we are in the process of forming a program board where we look at diversity, equality, and inclusion. And also we are looking at programs where we encourage dental professionals from the BAME minority group to go into leadership positions where we are underrepresented. We are working with the faculty, and we are also within our group, we encourage and sponsor anyone who wants to go into leadership positions in any of the organizations that are involved in dentistry. Thank you.
Great. Thank you very much. Thank you for that. We're going to go into some of the questions. We've got a lot of questions for you guys. So apologies to everybody if we can't take every question, but we will cover as much as possible. So if I can go to some of the first ones, we'll just show it on the screen. Does the association run clinics for BAME communities? If yes, how do people get to know where to attend? Towards the end, we will share information about the association, but perhaps Timi, if you just want to answer that briefly.
Yeah, we don't particularly run clinics for the BMA community. What we do oral health care outreach in the community where we provide awareness on oral health and how they can access dental care. So that's what we do. We don't particularly have clinics for the BAME community. We just provide awareness, and we also direct them to where they can get oral health care.
Great, thank you very much. For Yewande, I want to bring up this question for you because you're the newest dentist amongst the group. So this is for your explanation in terms of what are the required grades to get into dental school. So if you want to talk about it in terms of your own personal journey, that's fine.
Yeah, so getting into dental school is essentially similar to the grades you'd need for medical school. They're both 5 years long, and essentially you have to do GCSEs. So you need A's really. I got 5 A stars, 5 A's and 3 C's, but you need at least A's in chemistry and biology. Those are the main things. So you don't have to have all A's, all A stars. As long as you have a strong interest in science and you can get the grades in those. So that's GCSEs. And then you go on to do your A levels. I done the International Baccalaureate, which you have to do 7 subjects, which obviously includes chemistry and biology. So you can either do the IB or A levels, and then at A levels you need A's as well. So A in chemistry and biology, and then that's that. So it's mainly focusing on chemistry and biology, and you could do one other subject which you need an A in. I done psychology, so yeah, the grades requirement is quite high, but that's because it is a demanding course, and they want to make sure that you can sort of handle it. But if you don't get the grades first time, not to worry, because that happened to me. I was actually 1% off my grades and I was absolutely gutted. I was really close to actually not doing dentistry because this happened to me. I was actually gutted. I think I went through such a difficult period in my life because, you know, when you're so focused on getting into something and it doesn't happen, you're just like, what do I do now? But I actually retook a year to do that subject again. That 1%, and I ended up getting the grade I needed. So it's not the end of the world if you don't have the grade the first time. If you really want to do dentistry, just keep on trying again. I remember when I got to uni, there was someone that was, I think, 29 and they were in first year, so they had clearly tried many times. So yeah.
Thank you very much. Just to come to Kavin, there's a few questions here about the nature of the profession. Do more African Caribbean dentists go private? So maybe you can talk about the structure in terms of setting up a private practice and so on and so forth.
Yeah, so there are certainly for consultants working in the NHS, you have a contractual obligation to deliver care. So I deliver 11 activities per week, and that's a combination of outpatient clinics, operating in theatre. I'm on the on-call rota, and so on and so forth. So for 1 day per week, I spend that time in private practice. And I think for the majority of people who are living in London, which is quite expensive, private practice is an essential component of that. In terms of people going fully private, 100% private, I think there are very few people who actually do that for two reasons. The first reason would be it's actually quite prestigious to maintain an NHS post, particularly in a teaching hospital. And the second reason is that in terms of professional development, maintaining your skills, the complexity of patients come through mainly through the NHS. So a lot of my private practice is very much relaxing surgery, there's such a thing, whereas my stressful work tends to be within the NHS, where the support structures for that are available. So I think in terms of how much time you dedicate to your private practice, that depends on your personality, your circumstances, and so forth. But I think for the majority of individuals, they'll spend at least half a day or day in private practice.
Thank you very much. The next question, and then we'll have to move on. If I can put this question to Sophia. The question is to do with the yearly intake into dental school is being limited. What's the percentage of BAME dentists in the UK? Just a broad figure. I think it was in the paragraph introducing the broadcast. So I don't know if you know offhand.
So of BAME, it's about, of dentists, about 49%, if I remember, I think one of the last statistics I saw. And of that, the majority of those are Asian background. I think Black dentists probably make, I'm going to say, between 1 to 3% of that 49%. And then there is a small percentage of unspecified, so we don't know what that is, and then the rest is white or British.
Okay, thank you very much for that. For our viewers, keep the questions coming, the comments coming. There's a hell of a lot. Unfortunately, I can't go through everything, but there's quite a bit congratulating you for the organization. A lot of congratulations to Yewande. I don't know why, maybe because she's the youngest of the group, but also congratulations to the association more broadly. So that's a good thing. I think let's move to another part of discussion. Of course, dentists may not be seen as part of the front line during a pandemic like this, but I see you definitely as part of that front line. And I think well done for everything you're doing to support people through this very difficult time. I just want to hear a little bit about your experience during this pandemic in terms of what's happening to practices owned by your colleagues, but also in terms of patients coming through, given that so many people had to stay away and a lot of practices were shut for quite a prolonged period. So if I can go to Andi, if you just want to talk a little bit about what you're seeing since the pandemic.
Sure. So I can give you the view from the hospital in that we tried as much as possible, especially for cancer operating, which is very time critical, to maintain the services. And I operated literally every week during the pandemic, and there were a lot of changes in terms of our practices, the requirement for PPE, the daily protocols coming from Public Health England, which most times were not very helpful. So patients were still coming to the hospital. They still had to be managed in terms of their COVID status. Some of my patients were positive. Some of my juniors also tested positive, and quite a few of the patients sailed through without any issues. What we're seeing now are literally the casualties of the coronavirus. So, for example, I held telephone clinics on a weekly basis for urgent cancer referrals, and I'd call. There's one particular patient I called every week for 6 weeks, and he refused to come in because number one, he was told by the government to protect the NHS, and secondly, he was scared of coming into the hospital and catching the virus. And I saw him a couple of weeks ago with a very advanced cancer, which has significantly reduced his chances of survival. There are lots of patients where the symptoms of coronavirus were massaged with other diseases. So, for example, if you had a cough that was persistent and you dialed 111, they'll tell you to stay at home and self-isolate for 14 days. A lot of these patients are now coming through with advanced throat cancers, and we're also seeing late-stage presentation lung cancers as well. So it's been a difficult situation all around for everyone.
Thank you for sharing that. Timi, did you just want to add something, maybe particularly in terms of the shutdown, the lockdown, and what's happened to a lot of the practices? Are they not coming back into operation?
Yeah, thank you, Nero. So the lockdown, we still had to provide telephone triage to the patients, and where we had to give advice and prescribe antibiotics. And obviously, we're coming back now. Like Kavin said, the symptoms are exaggerated, and now it's difficult to manage. Which also shows that the effect of not being able to see the patients, because it's an intervention exercise. There's only very little you can do from remote advice. You actually have to see the patient to treat the patient. So we're having a lot of emergencies now coming into practices where the symptoms have been exaggerated by the delay of them seeing a dental care professional. So we're dealing with that. Also, we have patients who had open courses of treatment which were not completed. So obviously, things have gone worse than before the shutdown. And the demands of PPE means we see less patients. So we're not seeing the same number of patients we could see, because we have to exercise some guidelines and protect the staff and the NHS. So yes, we're back to service, but at a very reduced performance. Thank you.
Okay, thank you so much. And Yewande, just to come to you. So you're a foundation dentist. So perhaps it would be good to share with people what that actually means, and then really the implications for you being at the front line at a time of a global pandemic, and at the time where the news is that people like you are at greater risk in terms of this particular virus. So just to share some of your thoughts and how you're coping with what's happening.
So just to answer your first question, a foundation dentist essentially is basically like a trainee medic, so like a junior doctor. So once we've graduated, we have a foundation practice that we are based in. So we have an educational supervisor who supervises us still. We're still official dentists, but we just have someone that we can go to if we do have any difficulties. So Dr. Timi is an educational supervisor himself. So they're designated practices that are for foundation dentists. So that's what a foundation dentist is. And this training lasts for 1 year. So obviously COVID happened, and overall I just felt it was very unprecedented. Like, we didn't have any idea this was going to happen, obviously. And going into my foundation training, obviously it's not going to be the same as it was for other foundation dentists. We'll as Dr. Timi said, we're going to be seeing much less patients, which I think is a bit unfortunate for us because, as you can imagine, you've just come out of dental school and you just want to do as much dentistry as possible. But obviously that's not going to be possible with COVID, all the PPE, everything that we have to go through. So I think a lot of foundation dentists are feeling very nervous at the moment. I start on the 1st of September. I don't really know how it's going to be for the first couple of weeks. But I'm excited and apprehensive. Obviously, no one wants to catch COVID. That's why in dental practices, the PPE measures, literally, they have such extreme measures in place to make sure that we're as protected as possible. So I guess we'll just see how it goes. And hopefully I do make the most of it anyway, despite of the current situation.
Well, it is a very serious situation. So I suppose given that you're at the front line, good luck to you all in everything that you do. We will move to some comments. There are comments here. Well done, Yewande. Uncle Dayo is proud of you. I don't know. You might know who Uncle Dayo is.
Come to my Facebook, so probably all my family and friends are watching this right now.
Okay, that's very good. We have a question here, which is a bit controversial, but nevertheless, let's go with it. So the question is asking, how do you sell dentistry to BAME community? Because it appears the community does not take oral care seriously. Sophia, would you like to have a stab at this?
There are a couple of things I would say about that is, I think dentistry and oral care, as a population, the UK probably doesn't see it as important as sort of general medical care. So I think it's the whole population that needs to be brought up to speed on why oral care is so serious. But I think for the BAME community, it's probably linking it with other systemic issues. So for instance, periodontal disease, which is gum disease, is shown to have links with diabetes, and we know that we do have a higher incidence of diabetes within the BAME community. So it's trying to find like a personal connection as to why the BAME community needs to take it seriously. Your mouth is part of your body, so it's just as important as anywhere else, and it is important. So I think, does that sell it, or do I need to sell it some more?
I think if possible, Timi, you might want to contribute, particularly in terms of what else is the. I know you run a project called One Child, One Toothbrush, which was an outreach project into communities. Do you want to just share what that program is and why you felt that there was a need to run such a program?
Yes, so thank you, Nero. So the program was like Sophia did. We were trying to sell oral health care to the community because we identified way back in 2012 that the BAME community don't take oral health care seriously, and it's part of the body. From your oral health, we can identify your prevalence to systemic diseases. So the One Child, One Toothbrush program was to encourage the community to take oral health seriously, and also to make those choices at very early in the age of the children, so that they understand that prevention is better than cure, and they don't have to have extensive dental treatment later in life. So that was the whole motive of the program, and we were very successful in the program, and we had sponsorship from the likes of Hair and Shine, and it was very popular at the time, and we still continue to do that. But like I said, it's a way and it's a catchphrase to try to sell the oral health care to the community. Thank you.
It's fantastic. I've actually witnessed this particular project myself. So I attended when you had an event on the streets of Croydon, and I saw the level of interest. So parents, different people from the community just passing by, just getting some information about oral health and using the opportunity to engage their children as well. So I think it's an important program, and hopefully something that you guys can build on. And of course, as you say, there are related issues, and there are many organizations just like yourselves that are hidden in some way, but are there to address some of these issues within communities. And I think as Sparks Africa, this program, we will hopefully shed light on some of these organizations as we move forward. Just a little bit of diversion before we go back into the next segment. So I've attended the organization's annual dinner. I think I've attended at least 4 so far. So I know Timi's dancing skills, and I know his singing skills as well. And I've seen all of you dance. And I think, jokes aside, it's such a powerful event to see such a collection of professionals from the Black community in the UK coming together, celebrating, networking, talking to each other, and so on and so forth, and being able to take the time off to let your head down and have a bit of a laugh as well, and raise money for good causes. I'm particularly mentioning the dinner because I was present at one of the dinners when there was a little bit of fundraising to support Yewande. And I think that links us to a conversation that I want to have, which is about your contribution as people of African descent living in Europe, your contribution to development in Africa. Yewande, I think I want to start first just to hear your story in terms of your trip to Ghana. Then we'll share a small clip, and then we'll have a conversation about that. So if you can just tell us that story about how you came to engage with this organization, what it did for you to make that possible.
Mm-hmm. Yeah, so I was in my 3rd year of dental school, and during the summer between 3rd and 4th year, I really wanted to take part in a summer project, so like an elective. An elective is essentially when you go to a different country to provide dental treatment, and I really wanted to do it in Africa. And there was this organization that I came across called Work the World. So Work the World, they have different electives all over the world, and Ghana was somewhere that they had. So I was drawn to Ghana. Obviously, the prices for these electives aren't cheap. I think it was around £2,000 that I needed to actually go and do what I needed to do there. And obviously, I couldn't really afford that. So I just tried to look for ways to fundraise. And I came across the African Caribbean Dental Association. They had a student scholarship where they were giving away £500 to a student. So I wrote in what I wanted to do, what I wanted to go there and do. And yeah, I won the scholarship and it was great. I managed to do some more fundraising. I started like a fitness class, started doing some like beauty business in uni to just raise money. And I eventually got to what I needed. I went to Ghana and it was an amazing experience. I managed
Okay, let me pause you there.
I can go on for
I will come back to you to talk about it, but we're just going to share a little clip of the trip to Ghana just so that we can see your experience over there.
So guys, I'm at the airport on the way to Accra. Woo! So we've arrived in Ghana. This is Kate.
Hello.
We literally just met now. Yeah, we're looking forward to the day, and yeah, we'll keep you guys updated. Hi guys, so today we're just exploring the hospital. It's the first day. We've just been shown around. We're about to go to the dental unit for the first time to see what it's like. So I'll keep
Great, thank you very much. So I think that's a wonderful thing to see, and of course, many congratulations to the African and Caribbean Dental Association for contributing to make that trip possible. Now, very important to us at Sparks Africa, we believe very strongly that it is important to connect the professionals, the people of African descent who are professionals anywhere in the world, to the home countries, to whether it's in the Caribbean, South America, or Africa itself. So it was very exciting to see that trip. I do want to give you the opportunity, Yewande, just to kind of give us a very brief experience, what was the experience like for you? Is it something that you feel you would want to go back to at some stage?
Yeah, so as I was saying, I think it was such an amazing experience to actually go to Ghana and do dentistry. It allowed me to really open my eyes to see the differences between dentistry in the UK and overseas. The hospital faced immense pressure. There were so many patients that needed to be seen, but there was only one dentist in the whole dental department. There were 2 dental chairs, but one of the dental chairs were broken, and we had to use the light on our phone to see what we were doing. So immediately I could see, oh, this is not what I'm used to in dental school. And yeah, we just had to sort of just make do. There were some instruments as well that were missing, but I really admired the way the dentists, literally, they just made it work. Managed to get so many patients out of pain. I remember going to Ghana, I had never actually done an extraction, but by the time I left, I had done over 20 extractions. So when I got back to dental school, I was like, yep, I can do the extraction. Even going to the orphanages, there was a young boy I met as well, and I was going through the oral hygiene instruction, and he was really excited, and he actually left saying that he wanted to be a dentist like me when he grows up. So I think stuff like that was really inspiring for me, because if I had never gone, maybe that idea wouldn't have been planted in his mind, and I just really hope that something like that can be possible. So yeah, I can go on for ages, but if you want to do what
no, that's okay.
I have a YouTube channel, so you can watch the video on my channel, which is Yewande Dental.
Thank you very much. That's very good. Sophia, I'm aware that you've also volunteered in Africa, I believe.
In Ghana.
Pardon? Do you want to share a little bit about that?
Yeah, so I went to Ghana as a dental student, I think it was 6 years ago. So it was during the Ebola epidemic. We decided we were still going to go. And that was with an organization called Global Brigades. And it was a joint thing. So we had the dentists, we had medics, and then other specialities. And we went to an area close to Cape Coast and set up a clinic. So we had dental care on one side, medical care on the other side. And we did dentistry just in this sort of makeshift clinic in the community, and then went around the community delivering oral health and medical health. And they also had a small optometrist there as well. And I think that it's one of the best experiences I've had in my life. And I would recommend anybody who's in a position to go back and do that sort of outreach work to do it, for sure.
Great, thank you very much. And Kavin, I think if I understand correctly, you are from Uganda. Yes. So
that's right.
Just want to know. Yeah. So my question for you really is about if I'm thinking about development in Africa, in any of the countries, I'm thinking that the professionals like yourself in the diaspora are incredibly important for turbocharging development in Africa. And somebody with your particular skills and experience can contribute not just in a kind of a voluntary way in actually practically doing dental work on the ground, but also critically in that sort of higher level policy role, supporting the dental councils in those countries to draft the right sort of policy, to put the right sort of programs for training and development in place, and so on and so forth. Is this something that you have participated in, or something that you're interested in doing in the future?
Yes, so I'll correct you, Nero, in that I was born in Arua in Uganda, which is by the West Nile, Maracha village. and my mother is from Jamaica, so I'm one of the original Afro-Caribbeans when you tick the box, as it were. You're quite right that there's a lot of need within diaspora, and particularly in Uganda. I'm also part of a charity called the Hiduma Head and Neck Foundation, and the purpose of this foundation is very much as you've described, to not only deliver the provision of care to the standard and quality we have in the UK, but also to deliver education and training to raise the standards within the very limited resources which are available in Africa. And you're quite right in that at the higher policy, strategic health management and development level, they are clinicians in the UK of African and Caribbean descent who I think we absolutely should pull upon their experience in terms of shaping how the future training and education and delivery of health in the diaspora will be delivered. So it's certainly something I'm interested in, and something that needs to be pushed with enthusiasm and vehemence for the future.
Great, thank you very much for that. And I think in terms of Sparks Africa, that's something that we want to find the right solutions to be able to push that sort of agenda of connecting professionals from all walks of life to development in Africa. So I think it's very, very important. And if I can just come to Timi. So to my mind, the African Caribbean Dental Association will have a significant role to play in this sort of area. Do you have any plans? Do you think this is a key area that the association will focus on in the future in terms of its developmental work?
Yeah, it's an important area which we cherish and we guard as well. We are in dialogue with dentists in Nigeria and in Jamaica as well. We have one of our members who is in dialogue with dentists in Jamaica. So really, yes, it's what we're doing. It's hard work, and we have to do it in stages. So it's something we're really interested in. And more so is, like Kavin said, it's also to provide resources for our colleagues in this area so that they can raise the standard of care to what we would expect it to be within the limited resources. So it's something the association is working on. As because we're a registered charity and we're self-funded, things like this do take time and energy. So maybe not with the same momentum we'd like it to be at the moment, but we are working on that to ensure that we work with our colleagues and help them to raise their standards. Thank you.
Thank you very much. We are coming very close to the end now. I think it's been a fantastic conversation, and I think the work that the organization is doing is absolutely excellent and absolutely needed in the community. There is a question here about whether or not you run mentoring programs. I know you do, so I won't bother you with that question, but the association does run mentoring programs, and we'll be sharing the details of how to contact the organization. Today, many people have joined on Facebook and have joined live on YouTube as well. So there's a lot of people watching the broadcast, and at the end of this as well, we'll also make the video available for people to watch. So what I will do now, as we're coming close to the end, is just to give you all an opportunity for final reflections. The last conversation that we had is really important to us. One, on the ground here in the UK, we do want to shine a light on organizations run by people of African descent, who are providing excellent services, shine a light on professionals from our communities who are doing great things as a way of inspiring the next generation of achievers. And this is one organization. I've been familiar with the work of the organization from the onset. I think I supported the organization in incorporation as a company limited by guarantee, and certainly into the future, an organization that we at Sparks Africa would want to collaborate with and work with and continue to shine the light on. So we look forward to that. And I will give you each now the opportunity just to say a few words. We will do it in reverse order this time. So if we can start with Andi to your last reflections. Thank you.
Yes,
Kavin,
I think it's okay. I think as African and Caribbean professionals, we are to some extent guilty of not broadcasting our achievements in that way. I don't know whether it's the nature of us as a people, but I suspect it's because we're very busy firefighting and maintaining the very high standards that we uphold. So absolutely, I think organizations like the ACDA are very important in bringing people together, in allowing us to network with other organizations, and the work that Spark Africa are doing is absolutely paramount in continuing this journey. And I hope we'll be back again on this show a year from now, reflecting upon some of the many new organizations that we've linked up with. And on behalf of ACDA, thank you very much for inviting us onto the show.
Thank you very much for that. So if we could go to Yewande, just some final reflections.
I just wanted to start by saying a massive thank you to Sparks of Africa and the ACDA for making this possible. It's been a great conversation, and I'm sure there'll be many more conversations like this happening. And just all in all, if there is anyone watching this that does want to go into dentistry and you are from a Black Afro-Caribbean background, just know that you can do it. We're all testaments to it, that you can make it happen and it is possible. So don't give up. If you ever need any help, I'm here for you. You can catch me on Instagram at Dr. Yewande Dental.
Thank you very much. So if I can come to Sophia.
Yeah, so again, thank you, Sparks Africa, and thank you for ACDA for supporting me and for having such a great organization available to us. For me, I would say just as Black professionals, I think we should really continue to collaborate and really encourage collaboration between us, and always just reaching back and trying to make sure that we're inspiring the younger generation, and really letting them know that there is so much things that they can do and that they have the potential and they just need the confidence. And then things like this just really continue to showcase Black excellence, because there's a lot out there, and as you said, people don't realize just how well some Black professionals are doing and have the potential to continue to do. So yeah, so thank you. And look forward
Thank you very much. And last but not least, if we can go to Timi for your final contribution tonight.
Yeah, thank you, Nero, and thank you, Sparks Africa, for having us on the show, and for highlighting and showing the light on us, because from history we know that some people don't know that we exist. We try as much as possible to make our presence, and we thank you for this show, because this is one of the shows that will highlight the association. And like I said earlier on in the beginning, the association was formed to address health inequalities and to encourage diversity within the profession, and to encourage the younger generation to seek career in the dental industry, because we know some people say we don't exist, as there are not a lot of Black dentists in the profession. So thanks for showcasing us, and we hope to collaborate with many more organizations like us in the future. Thank you.
Great. Thank you all very much. It's been an excellent conversation. I see this organization as a very, very important organization, and I will encourage all of you who are members to work for the progress of the organization, to make sure that it continues to get stronger for future generations. The work that you do, particularly around engaging young people in school to see themselves as potential future dentists, I think that's incredibly important. what you do in terms of supporting young dental students, mentoring them, providing them information so that they can understand the route to success. I think that's incredibly important. And the work that you do in communities to raise awareness about the importance of oral health, I think is incredibly important. So we must all support this organization to make sure that it's there to continue these very important work. All dentists should be members. All dentists of African descent, African and Caribbean dentists should be members. And young people from the community who also want to be dentists should join the organization. If you want to contact the organization, here's the information. The website is there for you to see, the Twitter account and the Instagram. I hope that you will be able to reach out to them and support them in any way that you can. Thank you all very much this evening for joining. A great thank you to our guests for their contribution, and for all our members who are watching across the world. People have joined tonight from Facebook and from YouTube, and as I said, the video will be made available on YouTube and on Facebook. Please subscribe to our YouTube and also click the notification button so that you can see our next broadcast. We will be coming back to you with guests from the United States and guests from other parts of Europe who are also doing great things. And eventually we will be moving to people of African descent living in the African continent who are making great contributions to shine a light on their excellence, as we say, to inspire the next generation of achievers. So, thank you all very much. Have a lovely evening, and we'll see you next time. Thank you.
Yeah,
Thank you so much.
Thank you very much, Nero.
Thank you.